Let's come on out, let's come together, fight AIDS.
Drug use and drug dependence have been inextricably linked with HIV/AIDS since the beginning of the epidemic. The link has to do with heightened risk both of contracting, transmitting HIV, and of worsening its consequences. Most people know that intravenous drug use and needle sharing can transmit HIV. However, little is known on the role that drug use in general plays. A person under the influence of drugs is more likely to engage in risky behaviors, such as having unsafe sex and sharing needles and syringes with an infected user. These are considered as the common ways of contracting HIV.
The most important thing for us as a country, Uganda, is to have a change of heart. As Ugandans, we need to have a way in which we can change our public health policy and laws to reflect on the aspirations of reaching the 90 HIV/AIDS reduction. And in this, we need to start looking at the frontiers, or who are the new drivers of the epidemic. The HIV scourge has tremendously changed, and among key populations is where we have the biggest number of new infections.
Tulina endwadde nnyingi nnyo kati ezitambulira mu bintu ng'ebyo ne bweba girita n'ogikozesa ate ne muno n'agikozesa oyinza okuba nga weesaze kati empisa eri weefumita wabeerawo omusaayi okukuvaamu kati munno bw'osheyalinga naye bw'oba olina obulwadde bwonna nga siriimu naye buba busobola omukwala.
Because of the strong link between drug use and the spread of HIV, creating awareness amongst people using drugs and the general population can be an effective way to prevent the risk and spread of HIV. People who use drugs lack services that include HIV prevention, care, treatment, and psychosocial support, which may reduce the risks of drug use risk behaviors.
Drug users is among the key populations in Uganda, and in most cases, this drug user community has been left out in most of the programs in Uganda, and you find that most of the programs that are programmed for key populations, drug users are always left out, and they also make part of the key population in Uganda. In general, when you look at when people are being left out, it means that that population will always be underground and will not always access the services.
Anyone is vulnerable to contracting HIV. Although injecting and other drug users are at high risk, anyone who has unprotected sex could be exposed to the infection. In 2010, the majority of 47,000 people diagnosed with HIV, many of the newly diagnosed, nearly 2/3 occurred in people who used drugs.
Omuntu asobola okufuna obulwadde mu kusharinga empisa eyo. Anti asobola okufuna obulwadde olw'ensonga nti empiso bw'ebanga eri emu n'ogisharinga ate nga jjukira nti egenda mu musaayi. So bwe njijja mu musaayi gwange ne ngissa ate mu muntu omulala, in case bwe mba nyina akalwadde naye asobola okukafuna, naye okirowoozaako n'omala n'okireka olw'ensonga nti ekintu ekyo obeera okiseyarinze olw'obuzibu buli bw'oba okola ki, olwa payini gy'oba oyina, payini ey'okuba nti tonnaba kufuna kintu ekyo kikozesa ekufoosinga okuba nti ne essaawa eyo ne kikwerabiza obulwadde buli bw'oyinza okufuna mu kusharinga empiso, so ne kikufoosinga ogisharinge.
Injecting drug users are the most stigmatized and discriminated population in Uganda, who continue to be marginalized, ostracized, and excluded in the programs and decision-making processes that affect their lives. This marginalization poses a threat to present our future generations.
Where we have been referring our clients or our members, sometimes when they go there to get services has also been a problem, because people look at them as criminals and they think they don't have a right to services.
I'm very concerned, though, that injecting drug users seem not to be part of the key affected populations that are going to be estimated. I've raised this at the relevant levels, and how I wish these population estimates can be done. The most important thing for us as a country is not to moralize the epidemic. Let us treat people, let us give them services, health services, let us enable them to get what they would need so that we see a reduction in infections.
The Uganda Harm Reduction Network, UHRN, was established in response to the apparent need of a coordinated, unified response to the drug user crisis by creating awareness on health and policy programs that promote good practices and supportive environment for the implementation and expansion of harm reduction interventions for people who use drugs in Uganda.
I used to inject drugs for quite a long time, approximately 6 years. And when I visited other countries, I found that most of the drug users group have formed, and Uganda was, we had no association that we could connect to. So me and my friends, we sat and come up together with an idea, what could we do for ourselves? So we sat and agreed, and we started a network that has been mobilizing for drug users countrywide to know their rights and health.
The organization realizes that injecting drug users psychologically have incapacitating effects of reducing and quitting injecting drugs. It is also acknowledged that there is need to accept drug use as a public health issue rather than a criminal justice matter. But also, there is a need to conduct a study on the magnitude of drug use predicament with the view of finding lasting solutions. The organization seeks to achieve its goals and objectives through creating awareness, advocacy, campaigning, lobbying, research, and information dissemination.
I would strongly recommend that even if it is a small study in selected either districts or regions, there is a need to make such a study. Because once you have a study and you establish the reality of the situation, that information that you have gathered, it is very, very important to help in policy development, in development of operational guidelines on how this can be done. It is that information can help also even to develop training materials that can be used. Similarly, also such information will be very, very helpful in the review, for example, of the National Strategic Plan on HIV and AIDS, or the one on tuberculosis, or any other related, diseases.
They have a part to play in the problem of the epidemic in this country, and they need to be engaged, and we need to find a way to help them and fight this epidemic, because at the end of the day, they are going to this infection trickles down into the general population.
The Uganda Harm Reduction Network mission is to improve the health, human rights, and socio-economic well-being of people who use drugs through leadership building, collaboration, and capacity enhancement of Uganda Harm Reduction Network members to uphold harm reduction intervention. And through its programming is committed to raise awareness and promote effective access to quality prevention, treatment, care and support services for people who use drugs living and affected by HIV, sexual reproductive health reintegration, tuberculosis, hepatitis and other related health issues.
The people that we categorize as key populations are not from the moon. They are part of us. They are our own either brothers or sisters or parents or children. And therefore it would be very unfair if we stigmatized or discriminated them because of what they are. What possibly we need to do is to help them, support them, and brace. Like people who use drugs, this is really, it is a disease. Because people get addicted, and because of that addiction it becomes very difficult for them to. So these are people who actually need support. So we should actually come out and support these people. They already have a lot of challenges, social challenges, but also in addition to social culture challenges, they are already people who are heavily burdened by HIV. Therefore it is very, very important that we come out and support these people to access services, but also to support them psychologically, socially, and morally.
We would advise the government to look at people who are using drugs as a community health problem, not as a criminal issue. So when you keep criminalizing people, people will fear to go for services. So it's good at least to remove all those laws that hinders for drug users to access services.
The Uganda Harm Reduction Network is targeting the World AIDS Day platform as an opportunity to remind the public and Ugandan government that HIV and AIDS is still a reality, and it's incumbent on every one of us to continue fighting prejudice, stigma, and discrimination, ensuring that discrimination on basis of behavior and nature of lifestyle is reduced.
Yeah, basically I would love to urge or to call other civil societies to support the issues of drug users, to come up and support this call. This is not our call. This is a community call or a country call, because a drug user may be a drug user, but a person whom a drug user sleeps with may not be a drug user. So, in order to fight against HIV, in order to reach at 90-90, we all need to join hands in this fight.